Speaking of men and the health of the family as a whole, there's many families out there that are watching the show today, this morning, and they're thinking about prostate cancer, and how that has impacted a man within their family line. As we think about prostate cancer screening, and you've been a part of this for many, many years, Doc, prostate cancer is still the second leading cause of cancer death amongst men in the United States. What do men need to know about screening? And when should they start to have this conversation with their doctor?
That's a great question. And a lot of times physicians are given information that may not be up to date
Mhm.
or actually accurate, in the sense that they don't have access to accurate information because the U.S. Preventative Services Task Force continues to muddy the waters as to the role, accessibility, and value of screening for prostate cancer, because they don't really understand that there are so many new advances in screening opportunities that have progressed since the time of the U.S. Preventative Services Task Force recommendations back in 2015.
Wow.
We know that we are presently in the middle of a global epidemic of prostate cancer, not just here in the United States, but everywhere across the globe. They're seeing rises in prostate cancer, not only in the elderly population, which is the highest risk for prostate cancer because age is the #1 risk factor, but we're also finding higher incidence of prostate cancer in men in their 40s and 50s. And so what we are recommending is that men take advantage of getting screened. And the screening test is just a blood test. That's all it is just a blood test. It's called the prostatic specific antigen, or PSA blood test. And this
Mm.
blood test has been around since 1979. The
Wow.
reason we know that this test is effective and has worked is based on numbers of international trials for screening that have been taking place since the 80s. And the data shows that screening does prevent death from prostate cancer.